The new COVID cases in lockdown Sydney are shocking. 239 infections, the highest so far. And we're warned it's going to get worse. There are tough new restrictions, and late today, news the Army's been called to help, possibly for 6 weeks. But is it all too little too late? Health consultant Bill Botel is an adjunct professor at UNSW. Frank Carboni is the Mayor of Fairfield, the epicentre of this current outbreak. Frank, I'll go to you first. Sending in the troops and having the military on your streets, outside your homes, outside your businesses, how's that going to be received?
Well, we don't know if that's going to happen, but of course that wouldn't be well received. What we do want and what we do know is our community is working really hard. COVID cases are coming down. I'm really proud of our people in Fairfield. We've done the tough yards, but this isn't just a Fairfield problem. What we do know is that tens of thousands of people leave Fairfield and the 8 LGAs every single day, and tens of thousands of people come into the LGA every single day. This is a Sydney problem. We need the Premier to step up and the Cabinet to step up. At the moment, we are getting policies which are not uniting our community, but are dividing our community, and it seems to be done by different segments of the Cabinet to appease different interests of the Cabinet. We need the government to be clear. I feel for the Premier. I know it's a tough job, but she needs to unite the community. We need to fight this together. We did this 12 months ago, and we can do it again.
Well,
and as far as the military goes, the Army.
The request for the military has been confirmed. It is going to be happening, and some people aren't doing the right thing, Frank. There's been a record 239 new cases, 66 of those infectious in the community, so spreading it further. Extreme measures have got to be taken, don't they?
Oh, that's right. And 71 of those cases were actually outside the 8 local government areas that are considered to be a hotspot. No one's talking about that. We're all in this together in Sydney. We all have a responsibility individually as a local government area. This virus hasn't been kept away from international borders. It's beat state borders, and it wasn't locked up in hotel quarantine or with the one limo driver. This is something that we all need to fight. I'm proud of our community. I know we're doing a great job. And as far as the Army goes, well, we would support the Army if they're doing contact tracing and supporting operational measures. Then that would free up the police to do what they want to do. The Army, after all, and the police are here to help the community, not to work against the community. And we need to make sure that the messaging is clear, that the community supports this, and that the information that the government gives is very clear to the community, because at the moment that information is not clear.
Now, Bill, the New South Wales Premier today claimed that Sydney now has the harshest restrictions that any state has ever had. Is that true?
No, not really. And of course, whatever you do today ought to really have been done 5 and 6 weeks ago. The Premier also said today that there was no rule book for COVID. Well, there is a rule book. It was written under terrible circumstances in Melbourne a year ago, and that rule book was applied in Victoria and in South Australia very effectively in the last few weeks to bring their Delta outbreaks under control and to return new cases to near enough to zero. That hasn't been done in New South Wales. So harsh measures taken when the virus is rampaging through Sydney as it is now, well, it's a bit too late. We've got to do a lot better. As the Mayor says, this is not just a Fairfield problem or a Liverpool problem, it's a problem for all of Sydney. And we've got to have an all of Sydney approach now to what we do to start bringing this virus under control.
Well, the reality is that 1 month in, the COVID cases just aren't improving, they're getting worse. So what's your view, Bill, on the Army?
Yeah.
Is that the silver bullet? Will that help things here?
Well, if it's necessary for compliance, yes. But look, if deploying the Army or the police conquered COVID around the world, well, I guess everybody would have been doing it. It's not so much the police and the Army that will get on top of this. It's contact tracing, it's the mobilisation of the community, as the Mayor said. But really, we've got to apply the same rule book as in Victoria. So the kilometre distancing, the use of masks outdoors, all of these things together brought the virus under control in the last 5 weeks in Victoria. Now, we've been said to look forward to vaccines. Well, that's very well and good, but that's 4 months away. We've got to think what really will make a difference in the trajectory of this virus in the next 4 days. And Frank, I don't see that those measures are being contemplated or taken.
And Frank, there is a lot of anger that the government didn't go harder earlier, and you've now got a third of the city locked down and paying the price of that. Have people lost confidence in the New South Wales Premier?
Well, there's no doubt that people are frustrated. The message isn't getting out really clear. We all need to work against this virus. We don't want to finger point against each other. We need to work together no matter where people live in Sydney.
But
what
do you
we
feel
do
like
know
she's
is
got
at
a
the
plan?
moment that no, I think that's one of the big issues. I think it needs to be really clear, a simple plan. The community has been fighting this for 6 weeks. We much rather do what we have to do. Let's get on with our life. Let's beat this virus together. But it needs to be across the whole of Sydney. There's no use eradicating the virus on half of Sydney and letting the virus spread in the other half of Sydney. That doesn't help anybody. What we need is a clear plan from the government to bring the community along. We need transparency and be able to provide all the community the information. And I'm sure that we will rise to the occasion. We did so 12 months ago and we will do it again. But we need to be united in this fight, not divided.
And Bill, masks are now mandatory when you step outside your front door in these COVID hotspot areas, even to exercise or just to get fresh air out in the garden. Is that necessary? Because no one's ever caught COVID outdoors in Sydney.
Well, that's not quite clear, but it's certainly use of masks outdoors was a very important part of the Melbourne response, and it did very well. All of them taken together create a package of measures that seem to bring Delta under control and put the cases going in the right way instead of the wrong way that they're doing today.
But we keep hearing, Frank, that we need a united message, and it's only applying the mandatory messages in those 8 COVID hotspot areas.
Oh, sorry, you're talking to me?
To Bill, just the issue of whether or not it's a useful thing to have the masks.
It is very useful, but of course, the virus doesn't understand the local government boundaries in Sydney. I doubt very many people could draw accurately the local government area boundaries where they live. So on one side of those boundaries tomorrow, you'll have to wear masks indoors and outdoors. Go across the road outside and you can take your mask off. Well, that doesn't do anything to impede the transmission of the virus in that area. That's just a political decision taken for political reasons, I'm afraid. It needs to be applied across the whole of metropolitan Sydney. That was how Victoria and Melbourne got its outbreak under control in about 5 weeks. And it's been 6 weeks since this started in Sydney, with no sign of it ending anytime soon.
Now, Frank, is that vaccine message sinking in? Because we've seen so much hesitancy about AstraZeneca. It's saving lives, though, and it's the unvaccinated who are getting sick and dying.
Yeah, but I think you admit people are confused. They don't know what age you can and you can't get it. The message keeps on changing, and that is the biggest issue. I think the messaging has failed, and we need to give people choices, and we need to give people confidence. And the messaging, unfortunately, that's been coming out from the government has not been clear. It has not provided people confidence, but there's no doubt that more needs to be done along those lines to encourage people.
And would you agree with that, Bill? Do we need to make it simpler, just with a message, if you're over 18, get the vaccine?
Certainly we do, and we've got to have the vaccine available wherever and whenever people can access it properly. But the vaccines, no matter, of course, how good they are and when they come, they cannot really do much to influence the trajectory of the cases tomorrow. So let's not keep doing what hasn't worked. Let's start doing the things that we know will work and do work. But that will require a much greater change of direction, I'm afraid to say, than we've seen in the last 6 weeks. 300,000 jobs, according to the Commonwealth Bank, are now at risk. And of course, we have dreadful health consequences, hundreds of cases, people in hospital on ventilators, and tragically people who have died. We want to keep those numbers where they are. We want them to come down. We don't want them to get worse. And we have got to really do a lot better tomorrow and in the days to come than we've been doing in the last 6 weeks.
And Frank, what is your message tonight? How are people in your area coping? Because the toll from this, it is immense, isn't it?
Well, our community's been fighting this for 6 weeks. What we need is the government to have a simple message tomorrow for everybody. So it's a simple plan, so there's confidence. I'm proud of my community in Fairfield. They've done a wonderful job. I know that nobody's outside. People are doing the right thing, but it just shows how transmissible this virus is of Delta. And don't forget, we've got tens of thousands of people coming into the city that could also be infecting our city, and tens of thousands of people going out. Keep up the great work, Fairfield. We're going to get through this. I know that united we will. We're a strong community. We're resilient. brilliant, and we will get there. But we need to do it together with everybody. It's not just a Southwest Sydney problem. This is a world problem. It hasn't been kept out of international borders, state borders, and it certainly wasn't kept out of a controlled environment when it came to hotel quarantine by the government. And the government's asking a lot by pointing the finger in certain areas to ask people to actually fight this virus. It's something that we all need to do together with the same restrictions and the same focus by everybody.
And you're right there that if we don't get on top of this in Sydney, it will be a problem for the entire country. Frank and Bill, thank you so much for joining me.
Thank you.
Thank you.